Yeah, well, this is not another COVID, but it is concerning, and to use the term that's been used a lot, this spread that we're seeing at the moment is unprecedented, because monkeypox previously has really only been seen in Western Central Africa with cases in other countries linked to travel from those areas. What we're seeing now is spread within countries, and it's been found now in over 75 countries, but predominantly spread within a particular community. That's men who have sex with men. And actually the risk to the general public in these countries, it remains very low.
According to the CDC, a rash that could look like pimples or blisters that appear on the face, inside the mouth and other parts of the body. But then the next question I ask is it deadly? And according to the CDC, it is rarely fatal, Andrew. So what are the ramifications health-wise?
Yeah, well, in most cases, it is a mild infection. It's unpleasant. The skin lesions can be quite painful, but most patients who contract it, they don't require admission to hospital. And actually, in this current outbreak, the mortality is very low. I think there have only been about 5 deaths reported out of the over 16,000 cases that have been identified so far. So very low risk.
Can I ask you then, do you agree with the way that this has been escalated by the WHO? Is this the appropriate thing to do, given everything you've told us so far this morning?
Yeah, well, I gather there wasn't universal agreement amongst the committee, the WHO committee. But I mean, the aim of this is to raise awareness, particularly in countries that haven't seen the infection so far. So improving preparedness, surveillance, so active surveillance to look for the infection, making sure that vaccines are available where they're needed. So I think all of these things can help to control this outbreak, which is alarming because the numbers have been going up and up.
I think at the root of my question really is asking whether the WHO feels that it has to react preemptively now because it was so heavily criticised for its original approach around COVID. Is there an element of fighting the last war about this announcement?
Well, there may be an element of that, and of course the downside is that it just causes panic. But I think it can be helpful, and certainly a global response is needed now because it's spreading to so many countries that have never seen a case previously.
Hi, I'm Joanna Bersecci, and thank you for watching. You can check out more of our videos by clicking on the boxes on the screen. And don't forget to subscribe to our channel for more from CNBC International. Thank you for watching.